This Docs on Call is brought to you by Excellus Blue Cross Blue Shield. I'm joined today by Dr. Micah Lissy, a sports orthopedic surgeon here at Union Endicott High School, and you work with UHS, and we're going to talk about sprained ankles. Now, what did they look like? How did they happen?
Sprained ankle, if we could just look at Kara Gorgos is our UHS sports medicine athletic trainer here at Union Endicott High School, and she takes care of a lot of the athletes here, and she's helping us out by letting me show her foot today. If we talk about an ankle sprain, usually what happens is the foot rolls in, right? So that can happen in a couple different ways. It can happen just by missing a curb or stepping into a hole and your foot will roll on itself, or if you jump and then you land on a foot or some other object, the foot will roll in, and that can tear these three ligaments on the outside, and when they're torn, causes a lot of swelling, a lot of pain, a lot of bruising in that area.
Is there anything else that people should really know about sprained ankles?
Well, the first thing you should know is that you need to rule out a fracture. You need to make sure that you didn't actually break any bones because it's a similar mechanism, and so x-rays can commonly help with that. But once you rule out that fracture, you should know that it can set you up for another injury in your ankle. You can injure your ankle again if you haven't appropriately rehabilitated it.
Now, should people rest? Should they get off their ankle if that happens to them?
Unlike other injuries where we usually immobilize things for a period of time, the ankle actually does better if you move it more in the short term. So right after the injury, it's not uncommon to get an ankle brace or some crutches to rest it, but as soon as you're able to tolerate the pain, as long as you know it's not broken, you should start putting weight through it, you start mobilizing, you should get into therapy to work on your range and strength and get strong for a return to sport.
All right, Dr. Micah Lissy with UHS, thank you for joining us here today. If you have any questions, you can visit our website at wbng.com, or you can call 584-7362, 584-7-DOC.